Good afternoon. I'm very pleased to welcome you to the launch of National Clinical Guideline number 28 on how to help people to stop smoking. Very pleased to have so many of you here with us this afternoon on what's a very important day as we take a step forward in terms of how we help people to stop smoking and on how we tackle the harm caused by smoking across the population. So in terms of this afternoon, we will have some opening remarks delivered by Dr. Philip Crowley and from Rachel Kenna of the Health Service Executive and the Department of Health, respectively. I'm then delighted to say that we have some important messages from Minister Frank Feehan and from Paul Reid, the Chief Executive of the Health Service Executive. Next then, I'll provide you with an overview of the National Clinical Guidelines. I'll speak about why we developed the guidelines, how we develop the guidelines, what they say, and what we're going to do next. Then in terms of stepping on from then, we'll have some panel discussion to which we have invited a number of contributors who will speak to the opportunities and challenges when it comes to implementation of the recommendations in the guidelines. Finally, then we'll wrap up with a contribution from Dr. Colm Henry, who's the Chief Clinical Officer with the Health Service Executive, and we'll hand back to Rachel Kenna, Chief Nursing Officer at the Department of Health, who will close the event this afternoon. I'll now hand over to Dr. Philip Crowley, National Director for Strategy and Research with the Health Service Executive, who will make some opening remarks.
Thank you very much, Paul, and thank you for including me in today's event. Really delighted to welcome the publication of Ireland's first National Stop Smoking Guidelines. As we know, we're in a situation now where healthcare costs continue to increase every year, both in Ireland and globally, probably at an unsustainable rate. So we've got to do something about prevention even more fundamentally than we're currently doing. McKinsey's reckon that behavioral modification can probably reduce the global disease burden by about 40%. The WHO say that if we stop smoking, increased exercise and had a healthy diet, 80% of coronary heart disease, 90% of diabetes and 30% of cancers would be prevented. I mean, that's a goal certainly worth fighting for. And in Ireland, the healthy lifestyle surveys have shown that probably 23%, I think, of our population were smoking in 2015, and that reduced to 18% in 2019. So we're starting to get something right, I think, in Ireland, but we need to build on that. And 40% of those interviewed had tried to quit in the previous year. So we have a population, I think, that's ready for these guidelines. I'd really like to thank Paul Kavanagh and Ashton Sheridan and their work with the very strong clinical guideline working group that developed this guideline. I know it's a very arduous process. I set up the NCEC when I was working in the Department of Health as Deputy Chief Medical Officer, so I'm somewhat responsible for the arduousness of that process. So I understand that it is not easy to get these guidelines done. And it's a huge amount of work, and well done to everybody and for their participation and their time that they gave to it. But the one thing you get out of that, of course, is a guideline of very high standard, very robust and very evidence-based, and one in which I think the community can have a lot, both the clinical and wider community can have a lot of confidence in. It's not something that we've made up, it's based on evidence. Smoking-related illness is a massive impact on our society. We estimate that probably this week alone, 1,000 people are hospitalized as a result of smoking-related illness. And it's probably the single biggest cause of preventable death. So it's something that we need to constantly work on and improve our work in this space. And everyone can make a difference. It's not just a few people. I think it's anybody working in our health service can make a difference. They can make every contact count. Because when people come in when they're ill, it's what's called a teachable moment. So it means that people are a little bit more open to ideas about changing their behavior because they're concerned about their health. And that's why they've come in to see you. So we have a great team in the Tobacco Free Ireland programme who have been leading our work on tobacco-free campuses and all of that, and have been instrumental in ensuring that these guidelines come into place. I think these new guidelines now will strengthen our efforts. They're very clear guidance on a good stop smoking care, what it looks like. And I think it's very important that there's clear emphasis in these guidelines on groups that maybe are particularly important, such as those who are users of our mental health services and women who are pregnant. 3 easy steps. Ask if somebody is smoking. Are you smoking? Do you want to talk about it? Advise them to stop smoking and offer medication and smoking support. And with these 3 simple interventions, the quit rate is greatly increased. So I look forward to supporting on an ongoing basis the work of the HSE Tobacco Free Ireland team. and support in their support for all HSE staff in trying to use this evidence-based support to really drive down our smoking rates to zero. That has to be the goal. So I'd finally like to thank Martina Blake, Noreen Turley, I've already mentioned Aisling Sheridan, and of course Helen Deely in our health and wellbeing team, who have been so instrumental in all of this very important work. And I look forward to hearing Rachel Kennan now introduce herself as the Chief Nursing Officer. Thank you, Rachel.
Thank you indeed, Philip and Paul, and good afternoon, everybody. I'm also delighted to be here today at the launch of the NCEC National Clinical Guideline number 28, Stop Smoking. For those of you who may not be aware, my role as Chief Nursing Officer in the department includes the responsibility for the National Patient Safety Office. The Clinical Effectiveness Unit sits within the National Patient Safety Office in the department, and this unit then supports the National Clinical Effectiveness Committee. As Philip said, we are all aware that clinical effectiveness is a central component of patient safety. The integration of best evidence in service provision through clinical effectiveness processes promotes healthcare that is up to date, effective, and consistent. The NCEC was established in 2010 by the then Minister for Health and has grown as a partnership between key stakeholders in patient safety to achieve the overarching aim, which is to promote the clinical effectiveness agenda in Ireland through national clinical guidelines and clinical audit. NCEC National Clinical Guidelines, as Philip said, are quality assured and go through a very rigorous methodological process prior to their publication, and as such, therefore, can be trusted to provide the most up-to-date recommendations and knowledge to healthcare professionals in Ireland. Today's guideline on stop smoking is the latest addition to the NCEC suite of national clinical guidelines and has an important focus on public health. Tobacco use is the leading cause of preventable disease, death, and disability worldwide. The WHO has described it as one of the biggest public health threats the world has ever faced. Indeed, it has been estimated in that context that more than 8 million people worldwide die each year as a direct result of tobacco use or exposure to secondhand smoke. In the context of today, then, we also know that there are benefits to quitting smoking at any age. These include improved overall health and a reduction in the risk of premature death. In Ireland, we have a strong track record in terms of tobacco control, and this is recognised internationally. The current government policy, Tobacco Free Ireland, is Ireland's second such policy. This policy sets a target for Ireland to be tobacco free by 2025. And this means a smoking prevalence of less than 5% of the population. In addition, Tobacco Free Ireland is a key component of the government's current policy framework for public health, which is known as Healthy Ireland. The Healthy Ireland survey in December 2021 published the latest figures on smoking prevalence. And as Philip pointed out, we have made some progress in relation to stopping smoking, but currently 80% or approximately 18% of Irish adults currently still smoke. And while it's encouraging to see that the decrease of 5% since the first Healthy Ireland survey that was published in 2015, there is still more to do. This guideline on stop smoking will help healthcare professionals to identify and treat people who wish to stop smoking. A key focus of this guideline is on helping women who are pregnant, and this fully aligns also with the National Maternity Strategy. It clearly demonstrates the role that healthcare professionals, including midwives, can play at this really important time for expectant mothers. Stop smoking services are also part of a comprehensive approach to tobacco control. It is really timely that we are launching this guideline in January during the HSE's National Quit campaign. In terms of our launch today, I am personally really looking forward to hearing about the development of the Stop Smoking Guideline. And I also really look forward to the panel discussion on implementing guidelines in practice. And in particular, welcome the perspective from a person who has successfully quit smoking. The patient voice and public input is key in the development of NCEC guidelines, and I acknowledge and thank the patient representatives who participated in this guideline development for their group and their input. Thank you all again, and I hope that you enjoyed this afternoon, and I'm going to hand you back to Paul now. Thank you very much.
That's great. Really appreciate those words, Philip and Rachel. It's great to have you at the event this afternoon. I'm now pleased to introduce some pre-recorded messages from Minister Feehan, who's our Minister for Public Health, Wellbeing and the National Drug Strategy, and also from Paul Reid, who is the Chief Executive of the Health Service Executive.
Good afternoon. I am delighted to contribute to today's launch of the NCEC National Clinical Guidelines number 28 on stop smoking. As Minister of State with responsibility for public health, well-being and the National Drug Strategy, I particularly welcome the National Clinical Guidelines as an important advance in our national response to tobacco control. Smoking, as we are aware, remains the leading cause of preventable disease, disability and death in Ireland. We know that nearly 6,000 Irish people die every year from the effects of smoking. In the long term, smoking causes a range of illnesses such as chronic obstructive pulmonary disease, peripheral arterial disease, diabetes, aneurysms, stroke and 16 types of cancer. These entirely preventable illnesses may not develop for up to 30 years after initiation of smoking, and in the shorter term, smoking during childhood and adolescence causes both reduced lung functions and impaired lung growth. From the results of the Healthy Ireland 2021 survey published in December 2021, we have seen the progress that has been made in Ireland with a reduction in the prevalence of smoking. While this is a welcome decline, we still need to continue our journey towards our goal of a tobacco-free Ireland and to provide whatever assistance we can to the 18% of our population that still smoke. Ireland is recognised worldwide as a leader and innovator in tobacco control. In 2004, we became the first country in the world to introduce legislation to ban smoking indoor settings, including workplaces. And in 2011, we introduced graphic warnings on packages, and in 2017, we introduced standardised plain packaging on tobacco products. Our national tobacco control policy, Tobacco Free Ireland, contains over 60 recommendations to bring us closer to our goal of becoming a tobacco-free society. Guided by this national policy, we are using evidence-based approaches to remove the visibility of tobacco products from everyday life and to protect our children from the effects of smoking. Today's evidence-based national clinical guidelines becomes part of this. And we must use all of the interventions at our disposal, legislative, policy, cessation aids and taxation measures, to support people to quit smoking and prevent smoking initiation. Ireland's goal of becoming tobacco-free by 2025 is critically dependent on accelerating progress with smoking cessation.
Good afternoon, everybody. I'm pleased to welcome and endorse the publication of Ireland's first National Stop Smoking Clinical Guidelines. Tackling tobacco use is a priority for all health services. There has been ongoing work and good progress made over recent years, but smoking continues to have a huge impact on the health of our population. Each year, almost 6,000 people die as a result of their smoking habit, and thousands more live with disease and disability, which is avoidable. The impact on our health services is also substantial, with over 50,000 hospital admissions annually. COVID-19 adds another layer of urgency, since smoking increases the risk of severe disease progression. Every day, thousands of people use our health services, most of whom are concerned about the harm continued smoking is having, and they also express a desire to stop smoking. With the new National Clinical Guidelines, we can work together by offering the help and support to make this change. The benefit of quitting at any stage in life is clear. the evidence is helping and encouraging people to stop smoking. Too many people try to stop smoking without support, which limits success. Asking about smoking behaviour and advising people to stop, including medication and referral to a HSE stop smoking advisor, increases the chance of success fourfold. Aiding a smoker to cease their habit is one of the most powerful steps any of us in the health services can do in our roles. These new national clinical guidelines will make these steps easier to take and will help us continue our efforts to tackle smoking. Best wishes with your launch today.
That's great. Really good to have those contributions from Minister Feehan and from Paul Reid for the launch of these guidelines today, because that sends a really important message from leadership in government and leadership in the Health Service Executive that from their perspective, good stop smoking care and tobacco control continue to be a priority for health policy and for our health services. So next, I'm going to bring up a presentation and I'm going to speak to you about the development of our stop smoking guidelines. So I shall share this now. Okay, so in the next 10 minutes, I'm going to speak to you about the clinical guidelines. So I'm going to explain to you why we developed them. I'm going to talk a little bit about the process, which Philip and Rachel alluded to already, that we were required to follow in terms of these being national clinical guidelines. I'm going to set out at a high level what the guidelines say. I'm going to speak about what happens next. And finally, then I'd like to take some time to make some acknowledgements and offer some thank yous in terms of people that helped with the process. So it's very easy for us to think that our work in terms of tackling the harm caused by tobacco to our population, it's very easy for us to think that that work is done. We have benefited from strong political leadership, which has delivered a programme of high impact policy interventions over the last number of decades that have tried to tackle the harm caused by smoking. And we've seen that translate in terms of declining smoking prevalence across our population. And in 2013, Ireland was one of the first countries globally to announce its intention to try and build a tobacco-free Ireland. So in other words, try to bring the harm that's caused by smoking to an end. The reality, however, is that we have a lot more to do. So each week in Ireland, over 100 people die from smoking-related harms. That's more than enough to fill a bus. And it's very easy for us to overlook the fact that we are still deep in a continuing epidemic of tobacco harm across our population. And it's very easy for us to become desensitized to that and for it to lose visibility and urgency. The other thing for us to have a keen focus on is the fact that smoking, there's a huge gap across social groups in our population, and smoking is a big contributor to the wide gap in life expectancy and the 5 years less that people who live in poorer parts of our country can expect to live compared to those people who live in more affluent parts of our country. So smoking is a big factor that drives the very significant health gap across our population. Despite recent trends in terms of declining population prevalence of smoking, we have most recently in the 2021 Healthy Ireland report seen that smoking prevalence appears to have stalled. And there could be a number of different factors contributing to that, but that is a concern. And notwithstanding that, it's very clear to us that we are some way off achieving that goal that government announced, which is that Ireland would be tobacco free by 2025. So a lot more for us to do. People might take a view, well, really, is this a concern? Is this an issue for the health services? And of course, the answer is it's a very significant issue. So you can see on the left-hand side here some of the key statistics that delineate the degree of impact that there is from smoking-related harm on the health services in Ireland. So in an average week, over 1,000 hospitalizations, over 2,000 outpatient episodes related to smoking. And people who smoke are at a 20 to 40% increase of consulting with their general practitioner. If we were to go into any of our hospitals across the country today, 1 in 5 people who are there for respiratory illness are there because of smoking-related harm. 1 in 5 people who have been diagnosed with cancer in our hospitals are there because of smoking-related harm. And 1 in 5 people who are in our hospitals because of circulatory illness are there because of smoking-related harm. And the costs are staggering. You can see them delineated on the slide there. So almost €500 million spent each year within the health service budget on tackling harms that are due to smoking. In other words, for every time that we spend €100 on health services in Ireland, €2.50 is spent tackling issues that are caused by smoking. Now, of course, the HSE has stood up to this. And I'm very pleased to note that the HSE does have a tobacco-free campus policy, and it does have a strong commitment to tackling the harm that's caused by smoking across our population. We deliver stop smoking services, and on an average working day, over 1,000 people across the country use quit services across online, telephone, and face-to-face services. But there is more that we can do. We know that most people in the population who smoke, they actually want to quit. Recent data from the Healthy Ireland survey would indicate to us that 1 in 2 people who smoke made at least one quit attempt in the last 12 months. However, what's unfortunate is that too many of those people who smoke, who make a quit attempt, go it alone. And what's more worrying still is that when we ask them, 7 out of 10 people who smoke don't recall that their smoking was raised with them by a healthcare professional the most recent time that they accessed the health services. So there is a care gap that we look forward to addressing through the implementation of these guidelines. And of course, COVID just adds another layer of urgency in terms of the work that we need to do. We know that smoking increases the risk of severe disease progression with COVID. We know that COVID causes many of the chronic diseases, which mean that people don't have a fighting chance that they become infected with COVID. And we also know that COVID directly and indirectly has disrupted the delivery of stop smoking services, and also has had effects in terms of people's smoking behaviour. So really, from our perspective within the Tobacco-Free Ireland programme, COVID is very important, and we would see it as adding an additional layer of urgency in terms of the work that we need to do in helping people to stop smoking. So how did we go about developing the guidelines? We followed a process that was set out for us by the National Clinical Effectiveness Committee. We accessed and we adapted a number of international guidelines that went through a quality assurance process under the Clinical Guideline Development Group. And we linked this with a number of evidence reviews that were produced locally. And these included a health technology assessment that was conducted by the Health Information and Quality Authority of stop smoking interventions, and a number of reviews conducted by the Health Research Board at the request of the Department of Health, looking specifically at the issue of e-cigarettes. So we took that evidence and we worked through it systematically and explicitly, considering the evidence, analysing it, and linking it with wider considerations so that we could arrive at judgments and decisions in terms of the recommendations that we would make around stop smoking care. And we set those recommendations out in a draft document, which we put out then for challenge and for consultation through a public consultation, which was widely promoted and to which we had a high response and a large level of interest. I'm also pleased to note that we provided the draft guidelines to a number of international experts. So Prof. Charlotte Pissinger, based in Denmark, and Prof. Kenneth Ward, based in the United States. And we asked them to offer us constructive challenge and feedback in relation to the quality of the guidelines, which they did. Finally, then as well, in terms of a triple lock from a quality assurance perspective, the guidelines were scrutinised and assessed by a panel that was assembled by the National Clinical Effectiveness Committee. So I think it's important to note from the perspective of the public and from the perspective of our healthcare professionals that these final guidelines, really they can be used with confidence that the care that's recommended within them is care which is safe, effective and clinically sound. So what do the guidelines say? The guidelines are applicable to the general adult population, and they can be used by healthcare professionals across our health services in primary care, community care services, and in our acute hospital services as well. In essence, what the guidelines do is they ask our healthcare professionals when they're providing care to take 3 steps, which are simple and easy to remember. That is to ask people about their smoking. If they find that somebody is smoking, to advise them about the harms and advise them that they should stop. And finally then to arrange care, which they might provide themselves or which they might signpost and link somebody to enable somebody to make an attempt to stop smoking. And the recommendations are based on evidence, which I have set out in the previous slides. And I'm pleased to note that in relation to these 3 steps, and particularly the first 2 steps, asking routinely about smoking and advising people about harms and that they should stop, the evidence, when we reviewed that, we found that to be of very high quality, and the strength of recommendation around those first 2 steps was very high. And the evidence would indicate that compared with not providing care, routinely asking people about their smoking behavior and then advising them about the harms of smoking and that they should stop smoking, that can double the chances that somebody will make a successful quit attempt. In terms of the third step in relation to stop smoking care, this is around arranging that somebody would access behavioural support and a stop smoking medicine. So in terms of the guidelines, we reviewed the evidence, and you can see on this slide here set out the types of behavioural and stop smoking medicine support that are recommended within the guidelines. You can see there in terms of behavioural support, individual group counselling, telephone support, text messaging support, and internet support. These are all behavioural support services that are currently provided by the Health Service Executive. They're available to people free, they're very easy to access, they're available across the country. And I'm pleased to note that when we reviewed the evidence, we found that the quality of evidence supporting recommendation of those behavioural support options was high, and that our strength of recommendation in relation to those support options was strong. Similarly then, when it came to stop smoking medicines, in line with a health technology assessment conducted by the Health Information Quality Authority, the first line care that we would recommend from a stop smoking medicine perspective for somebody who smokes that's going to make a quit attempt is that somebody will be prescribed a medicine called varenicline with or without nicotine replacement therapy. If for various reasons varenicline is not an option for that individual, the next option that we would recommend is combination nicotine replacement therapy. Finally then, nicotine replacement therapy as a monotherapy, or a medicine called bupropion with or without nicotine replacement therapy, and a final medicine called nortriptyline. These can also be used, but we would not recommend them as first line. The first line option that we would recommend is varenicline with or without nicotine replacement therapy, where that's an option for somebody. And again, when we reviewed the evidence for those stop smoking medicines, when we looked at them systematically, what we found was that the quality of evidence supporting recommendation in respect of those stop smoking medicines, the quality of evidence was high, and the strength of recommendation that we could make was very strong. And what we know is, in addition to asking and advising people to stop smoking, if somebody in addition is linked with one of these stop smoking supports in terms of behavioural supports and stop smoking medicines, then that actually increases their chance that they will make a successful quit attempt by 3 to 4-fold. So in a healthcare professional's working day, really this is one of the best things that they can do in terms of offering people the opportunity to enjoy good health. In addition to those recommendations in relation to the general population across our health services, the population has a special attention given to women who are pregnant who use our maternity services, and also users of our secondary mental health services. And we delineate for those population groups what good stop smoking care would look like. Finally, then, in terms of our recommendations, the clinical guideline group needed to examine the contentious issue of e-cigarettes and determine what we would advise healthcare professionals do in respect of e-cigarettes. As I noted, this is a contentious issue, but it's also important to say that what we found was that the NCEC process that we followed did guide us through this issue in a very robust, systematic and explicit manner. So we looked carefully at the evidence, and we were able to lean on evidence that was provided by the Health Information Quality Authority to its health technology assessment, and also a number of evidence reviews that were conducted by the Health Research Board in Ireland and have been published. So we looked at those systematically, and then we linked our consideration of the research evidence with additional considerations, and we were very explicit around that. All of this is stepped out within the guideline document. And we arrived at what we felt were well-reasoned, evidence-based judgments in terms of what we would recommend around e-cigarettes. So when we looked at the issue of e-cigarettes, we asked 3 questions. The first question was, do e-cigarettes work as a stop smoking support? And really, when we looked at the evidence, we had low confidence that the evidence was robust, complete or stable There have been some studies in this area, and some studies have been useful, but overall the body of evidence was small and the quality was really quite mixed. So as I say, we had low confidence in the body of evidence, and we didn't feel that it was robust, complete, or stable enough for us to be able to make a recommendation in respect of e-cigarettes. Importantly as well, we weren't confident that the findings of studies that were positive in this area would necessarily translate outside the very specific conditions, the settings and the types of e-cigarettes that were used in those studies into general practice. The second question that we asked ourselves then is, are e-cigarettes safe? And while we know that the harms associated with e-cigarettes do appear to be less than the harms associated with combustible tobacco products, there are still a lot of questions and uncertainties in terms of their safety, particularly in the long term. And we felt that a recommendation in relation to e-cigarettes would be associated with, for the perspective of a patient and a healthcare professional, quite significant uncertainties and trade-offs in terms of risk and benefits. The other thing that we noted as well is that e-cigarettes are a consumer product, and that while they can be used as a stop smoking medicine, none of them have actually been authorised for that specific purpose by the Health Product Regulatory Agency here in Ireland. Finally, then, we looked at some wider considerations, and we noted that Tobacco Free Ireland, the National Tobacco Control Policy, has an explicit focus on protection of children and on denormalisation of smoking. And we linked that point within the national policy with findings from the Health Research Board in terms of the relationship between vaping and subsequent initiation of smoked tobacco use in children and young people. So that was a point of concern. So our view was that there were likely to be trade-offs between individual risks and benefits and population risks and benefits when it came to recommendations around e-cigarettes. And finally, in terms of wider considerations, we did note that there's a huge body of overwhelming evidence supporting the safety and effectiveness of the range of stop smoking supports that we have already recommended. So for those reasons, the guidelines don't make a recommendation to healthcare professionals that they should advise that people make a quit attempt with e-cigarettes. However, the guidelines do bring clarity to the issue from the perspective of the public and from the perspective of healthcare professionals. And the guidelines step out a number of points that can be used in a discussion between a patient and a healthcare professional around e-cigarettes. And very important to underscore as well that the guidelines make clear that HSE stop smoking services can still offer support to somebody who's going to make a quit attempt using an e-cigarette. And this is an evolving area and one that we will keep under review. Finally, then, in terms of what's going to happen next with these guidelines, this will bring us on to our panel discussion. So one of the good things in terms of the development of a national clinical guideline under the National Clinical Effectiveness Committee is that there is a requirement, once you have arrived at your recommendations, to examine barriers and enablers to implementation systematically, and then to work through the development of an implementation plan, which then is subject to a budget impact assessment. So we've completed that work. And I'm pleased to note that we already within the health services have a number of initiatives in place that are going to support the implementation of these guidelines. So these guidelines are well aligned with the work that's rolling out from the HSE in relation to the enhanced community care programme, and we're going to hear about that on our panel discussion this afternoon. These guidelines are also linked with the programmes that will be delivered to support people in some of our more deprived communities across the country in terms of the work that's rolling out around Sláinte Care Healthy Community programmes and the health improvement initiatives that are being delivered as part of that by the Health Service Executive. We've also been exploring the implementation of these guidelines in the maternity services, thanks to some funding that we have from Sláinte Care, and we'll be speaking about that in our panel discussion. I'm also pleased to note that we have been working with mental health services, and in particularly with Mental Health Ireland in terms of their role in representing people who have lived experience of mental health difficulties, to understand what they think the recommendations within the guidelines will mean from their perspective and how these guidelines can be implemented. And of course, these guidelines also link with ongoing work within the Tobacco Free Ireland programme in terms of the implementation of an electronic patient management system for people who use stop smoking services, our Quick Manager system, our implementation of Tobacco Free Campus policy, and of course the rollout of Making Every Contact Counts. So the guidelines today, they really do bring a keen focus to how we can best support individual patients who smoke, who use our health services, to make a safe and effective stop smoking attempt. So there's very much an individual focus within the guidelines that we're launching today. And I'm pleased that we have the support of Paul Reid, the leadership across the Health Service Executive, and indeed today an invitation extended to everybody who works within the health services to work with us in the Tobacco Free Ireland programme to implement these guidelines and to work with us on tackling the significant harms that are still caused by smoking across the population. But it's very important that we continue to work with our partners in the Department of Health and with the government to ensure that our focus on supporting individual people to stop smoking is matched with continuing policy action in terms of delivering tobacco endgame and Tobacco Free Ireland promise from our government. So finally then, some acknowledgements and some thank yous. Set out here are the members of the Guideline Development Group, and I really want to say thank you to each of them for their hard work, their perseverance and their good humour over the course of guideline development, which had a number of ups and downs along the way, and their hard work and perseverance were key in bringing us to this point. And I want to acknowledge as well the wide range of contributions that we had from a number of parties across the health system and internationally as well, feeding into the development of these guidelines. I want to say a special thanks to the over 50 stop smoking advisors that work with us across the country, with whom we met on a number of occasions over the development of these guidelines. And really those discussions that we had with them over the development of the guidelines enabled us to ground the guideline recommendations in the reality and in their experience of delivering stop smoking care on a day-to-day basis. I want to thank Dr. Keith Quintine, who really kept a keen focus on the management of the evidence base over the course of the guideline development process. I also want to acknowledge and say thank you to Martina Blake, the programme lead, and to Edward Murphy, the project manager with the Tobacco Free Ireland programme. And lastly, I really want to say a huge thanks to Aisling Sheridan, who was the project manager, who really kept the show on the road over the course of the guideline development and made sure that we did the work, we delivered it, and brought us to the launch of the guidelines today. So thanks very much, Aisling. So I'm going to come out of the presentation now. And what we're going to do is, we've talked a lot now. Okay. Yeah, okay, great. We've talked a lot about the guidelines themselves and how we develop the guidelines. And what we really want to do now was move on to talk about the implementation of the guidelines. So I'm very pleased to begin a panel discussion, and I'm very pleased to welcome a number of individuals who contribute to the panel discussion. So we have Martina Blake, who is the National Lead for the Tobacco Free Ireland programme. We have Dr. Jose Ayala, who is a Senior Health Promotion Officer with the Health Service Executive. We have Majella Phelan, who's a stop smoking midwife working in Cork University Maternity Hospital. We have Dr. Margaret O'Grady, who's a consultant psychiatrist in Galway Mental Health Services. We have Dr. Mark O'Kelly, who's ICGP lead for chronic obstructive pulmonary disease and is a GP working in Rialto Primary Care Centre in Dublin. And last but by no means least, delighted that we're welcoming Gary English, who is a public representative and is somebody who previously smoked but accessed HSE's stop smoking services and successfully stopped with that support. So I'm going to kick things off, and I'm going to begin by speaking to Gary. So Gary, you recently successfully stopped smoking with support from the HSE stop smoking services. So we'd be very interested to hear from your point of view, what were the benefits when you stopped smoking, and how do you feel that using HSE stop smoking services helped you on this occasion be successful with your quit attempt?
Well, I have to say that it helped me in terms of my overall well-being. For the first time in over 40 years, I in fact could feel my lungs expand in the back of my body. And I found that I wasn't out of breath. I had a horrendous cough. The cough cleared up within 3 weeks of I stopping smoking. But I have to say, I would never have done this except for the HSE. And the reason I say this is because I have done acupuncture, hypnotism, I had done everything, right? And I couldn't give them up. And then I met a lady, Carmel, inside in James's, who's one of many, many people out there helping people stop smoke. And she was exceptionally good. And she reminded me, who's in control here, the cigarettes or you? And that one word made me think, hang on, that's it. I'm not in control of these anymore. As I say, my own side of the family, my mother and grandmother both died from emphysema of the lungs. But even forgetting about that, the other issue is that you can get what they call a nicotine leg, where basically your entire foot, the veins turn into nearly nicotine rather than blood, and you end up losing a leg.
Okay.
So I just said to myself, yeah, and without the help of the HSE, I would not have stopped at this stage.
That's great. Well, look, well done on your success, Gary, and I'm delighted to hear that. And very important to note then that from your perspective, taking the step to stop smoking with help from the HSE was critical in terms of your success. And you spoke about working with a stop smoking advisor, and I'd like to bring in Jose, who's one of over 50 stop smoking advisors available for people to access across the country. And their services are free of charge, very easy to access, and can be tailored to the individual's own needs. So Jose, from your perspective, listening to what Gary said there, and then thinking about these guidelines, how do you think these guidelines are going to help in terms of the really important work that you do?
Apologies, Paul. We appear to have lost you for just a moment.
That's
if you
okay.
could repeat the question.
That's great.
Please.
That's great. Okay. Jose, I was going to invite you to come in. So you're one of 50 stop smoking advisors who work with people across the country, providing easy to access, free, tailored stop smoking support. So listening to Gary's story there, can you tell us what you think these guidelines are going to mean for you and for your fellow stop smoking advisors across the country?
Yeah, thanks, Paul. Yeah, first of all, thanks for inviting me to this panel. So these guidelines, which again are very welcome, they're going to become now our new set of national evidence-based recommendations for stopping smoking. And they're going to give us, I guess if we look at the higher level first, a type of parity with other clinical guidelines that have already been established throughout the health service. And in other words, they're kind of giving us a more level playing field in which it gives the importance to our services in which to run in that context. And this leads to the other point again, that these clinical guidelines will formally reinforce and reaffirm what we've known for a long time now, and that is that not only are stop smoking interventions cost effective in terms of the cost to the benefits to the health system and to individuals, but that again, it's going to reinforce that properly facilitated behavioral support alongside pharmacological support will greatly increase a person's chances of quitting smoking. And that's the bottom line of what we're at in this job. And so when you look at for everyone involved, from the service users, the clients, and for ourselves as service providers like myself and our teams nationally, these guidelines provide a very clear, very standardized framework on the most effective models for smoking cessation and stop smoking care by highlighting the best practice recommendations to ensure that the greatest quality standards in our service and the best outcomes for the population. Yeah,
that's great to hear, Jose. And I know from an individual service user perspective that these services are transformative. I think we've heard that in terms of Gary's experience. And of course, I think what today does is it reminds people that they're also transformative in terms of our health services, because they'll start to alleviate the pressure that's caused by smoking-related harm on our health services and contribute towards our goal of a tobacco-free Ireland. So moving on, Margaret, one of the decisions that we made early in the development of these national stop smoking guidelines is that we would bring a special focus on stop smoking care for people who use our secondary mental health services. And you work as a consultant psychiatrist in Galway, and you're known to us in the programme because of the great leadership work that you've done in establishing a tobacco-free campus within a secondary mental health service, something that many people said wouldn't be possible to do, and you've done it and you've seen the benefits of it. One of the things that's often said about mental health services and people who use those services is that there's a risk that those service users don't enjoy parity of esteem or could be left behind when it comes to their physical health, and that their physical health is often overlooked, particularly when it comes to their smoking and ensuring that they receive good stop smoking care. What have you found in your experience are the challenges to delivering good stop smoking care as part of secondary mental health services in Ireland?
Well, I think if we think about stigma first, Paul, it's often well intended, but misplaced concern for patients that has limited progress for us. And certainly service users have been left way behind. And a lot of it is about culture and assumptions that we make about the patients themselves. Actually, the last town hall meeting, I call them town hall meetings, when I meet with service users in the lobby of our unit. And I would say that 9 out of 10 people, when I asked them, wish to stop smoking, even though these were a group of people who came to talk to me and let me know what a bad idea they thought it was that we were implementing a tobacco-free campus. So even in that sort of setting, actually, when asked, 9 out of 10 wished to stop. Also, I think staff, healthcare professionals who try and implement a policy like this are seen as being uncaring or cruel to patients, because there's an assumption that service users need to smoke to help their mental health. What in actual fact is happening is that people are addicted to nicotine, they become agitated, they're in withdrawal, they have a cigarette and they feel better, and they think that this is helping their stress levels. And sometimes that's shared by staff as well, because we have the issue around fears around aggression in a mental health setting, where people may be behaviourally disturbed, and we're doing something like this at a time when they're in crisis. But what we like to think about is that we're treating it like an addiction. If we have patients admitted with alcohol or substance use addictions, we don't give them the substances or the alcohol. We provide evidence-based replacement and reducing regimes for them. So it's about tackling all of these perceptions head on.
Yes.
And also the fact that I think that still, I'm ashamed to say that facilitating or coordinating tobacco use in inpatient settings is still seen as a way of looking after patients. And I think we should be ashamed of that and not accept that.
So Margaret, I mean, that's very interesting. You've delineated some of the challenges for us that there are in terms of ensuring that people who use secondary mental health services experience good stop smoking care. And we know that they are 2 times more likely to smoke than people in the general population. We know that they experience significant physical problems in terms of ill health, and that smoking is a big contributory factor. How do you think that the launch of these new national stop smoking guidelines today, in particular the inclusion of a focus on users of secondary mental health services, how do you think this could help overcome some of those issues?
Yes, I think it's really important, and it's validating for staff who want to address this issue in the first place. It means that everybody is involved. All healthcare professionals should ask and support people in efforts to quit. And also, I think in our case, it'll be around implementing policy. I also thought it was interesting the way the guidelines acknowledge that when somebody is admitted to a psychiatric inpatient unit, that they're at risk of relapse. And that's something that I've found in my interactions with patients, is that people are quite shocked that some people only smoke when they're admitted to an inpatient unit. Some people have given up maybe 15, 16 years, and some people start. And that's very concerning, because severe mental illnesses are the chronic diseases of the young. So our patients are young, and we don't want them to start smoking when they're admitted to an inpatient unit.
Okay, Margaret. And Martina, can I ask, from your perspective and that of the HSE Tobacco Free Ireland programme, is there work ongoing that's going to help implement these guidelines in the secondary mental health service sector?
Yeah, absolutely, Paul. Through the Tobacco Free Ireland programme, we've been working with a number of partners in mental health. We've been working with Mental Health Ireland over the last number of years, and we're developing new guidelines for tobacco management and mental health services. And, you know, through that work, we're working with service users themselves, peer support workers and family advocates, and doing that in a co-produced way. We're also delighted to see an increase in the number of mental health services who are engaging in tobacco-free campus implementation and quality improvement. We've run the bursary process over the last number of years to incentivise and support sites to implement tobacco-free campus policy well, and over the last number of years we've had really good engagement from mental health services, which is really welcome, because we know that it's almost impossible to quit in an environment where there's smoking and there's a culture of smoking. So, you know, it's really important that the environment supports a successful quit attempt. And obviously a really big part of the policy itself is treatment, you know, so asking and treating and providing the environment to support people to stay smoke free. We've also worked with the Mental Health Commission, and we're delighted to see an increased focus on the physical health of those with mental health difficulties in the recent strategy that's been produced, and we look forward to working further with mental health services to implement these guidelines.
That's great. And moving on then to the other population that has a special focus within our guidelines. And if I could bring in Majella, who works as a stop smoking midwife in Cork University Maternity Hospital. Majella, these guidelines, they set out an improved model of care for women using our maternity services when it comes.
Paul, I think your sound is going a little bit.
To stop smoking, the services that you run and for the women that use those services.
Paul's sound is going a little bit. I might just take over there and just ask that question to Majella. So Majella, you've been working in Sláinte Care site in Cork University Maternity Hospital over the last 18 months. And the guidelines set out a new model of care where women are routinely asked about smoking in pregnancy at outpatients and antenatal, and offered carbon monoxide monitoring. And this will be a key step change in terms of the delivery of care to women in pregnancy. Do you think that there's going to be good uptake of the recommendations across maternity sites? And, you know, what has your experience been in Cork University?
So I've been implementing the service for the last 18 months, and it's a very welcome service. It helps to build on recommendations from the National Maternity Strategy to provide safer care for women and their babies, because the health implications of smoking in pregnancy has huge negative outcomes for both mother and babies. So I suppose this standardises the care to be delivered in other hospitals, gives standardised treatment and standardised recommendations. So the implementation of the breath carbon monoxide testing at booking visits, it helps to, it's recommended to be implemented for all women who book for antenatal care. And why we do that, it decreases any discrimination of any smoking women. It also helps to identify pregnant women who don't disclose that they're smokers. And the research would show that up to 40% of smokers fail to disclose because they have a fear of judgment. And these women do experience a lot of judgment. They experience a lot of judgment from other pregnant women who don't smoke. They experience judgment from healthcare providers who don't recognise the addiction and think that these are adult women who are making a conscious decision that is going to have a negative impact on their pregnancy. And they would also experience some judgment from partners who maybe are non-smokers and don't understand the difficulty these women have in quitting smoking, or from smoking partners who want to protect their child and think the woman should give up immediately. So that can cause some conflict in the relationship, which does decrease the woman's ability to quit smoking. So all the women in Cork University Maternity Hospital now, they're screened at booking, they're screened for their smoking status, and they're screened for their exposures to secondhand smoke. And they're provided with an opt-out smoking referral service. So all these women get at least one episode of care of specific intensive smoking cessation advice. And the service then is there for them to enter the standard treatment program to help them quit smoking.
That's great, Majella.
Yeah.
And Martina, if I could ask you, Majella has obviously road tested the model of care that's recommended in these guidelines in Cork University Maternity Hospital. It's really great to hear how that's going down there, Majella. Martina, I know with support from Sláintecare, we've also road tested this model in other parts of the country. And what have the findings been? What has the reaction been from women using the services and for the people who deliver those maternity services?
Yeah, thanks, Paul. So we were successful in getting funding through Sláintecare, and we implemented services in Cork University Maternity Hospital, Holles Street, and also in the southeast. They also were successful in getting funding for services. And what we found through the evaluation of both of those initiatives is that women do actually appreciate having a service on site. It's really, really important to them. But also even our learnings through COVID, that the blended model of care of being able to both access a practitioner on site, but also have the option of a virtual consultation and a phone consultation so that they don't have to come in all of the times for all of their supports. So women want a healthy outcome, and they want a positive outcome for their pregnancy. And, they appreciate the support, and the non-judgmental support really came out and rung through our evaluation, and that they found the practitioners really, really good in delivering that. The other thing I suppose we found is that there's a level of undiagnosed smoking. The number of women that we anticipated we would have through the service was much higher. So there's obviously more women smoking in pregnancy than we thought. We don't have good national data on this, so this is something that we need to look at in terms of assessing smoking prevalence in pregnancy. And we think that when we have implemented carbon monoxide monitoring properly, we'll be able to kind of get better data on that. And also the success of women. So, over the project in Cork University and Holles Street, even those two over 12 months, we had 700 referrals, 540 of those women engaged in at least one intervention. And of those who set a quit date, the success rate was really good. So 70% of them were quit at 4 weeks. So women really appreciate the service, and when they engage, they're very successful. And we look forward to working with the National Women and Infants Programme and our partners to rolling out this initiative across all of our 19 units, because that's what good clinical care is, where it's equitable and it's accessible to every woman, not just in pockets.
Okay, so just to round out our panel discussion in the last couple of minutes, I'd like to bring Dr. Mark Kelly in. So Mark, you're a GP in Rialto in Dublin, and you're also the lead for the Irish College of General Practitioners on care of people with chronic obstructive airways disease, working with the HSE Chronic Disease Management Programme. So we know that primary care, it's the first point of call for most people when it comes to their health, and there's continuity there. So you tend to see people over a long period of time, and we know that primary care is going to play an increasing role in terms of disease prevention and chronic disease management in Ireland. One of the things is, like we heard from Gary, that he stopped smoking because of health concerns, and many people who come to primary care who smoke might be well established as a smoker and may already have experienced harm because of smoking, be that lung disease or heart disease, a stroke. Some people may have even been diagnosed with cancer. That question is it ever too late for somebody to stop smoking? What from a GP perspective? Yeah.
No, very quick answer for that is no, it's never too late. I think it's probably with chronic obstructive pulmonary disease, or COPD, It's probably the most effective thing that a patient can do for their disease in terms of the impact of the progression of the disease, and then their quality of life and their level of breathlessness. And, you know, it's more cost effective and better for the patient than any inhaler we can put them on as a doctor. So a really, really important thing that we can do for that. Then along with that, you know, many people don't just have one chronic disease, as you'll know, that they'll have a number of them. And so with heart disease and stroke, it lowers the risk of recurrence. And then for people with diabetes, it lowers their risk of heart attack, stroke, and things like peripheral vascular disease that, as we know, can lead to amputation and limb loss. So really important, never too late. And the sooner we can do it, the better.
Okay.
I will just add into that, we've got a chronic disease management program now in general practice. So this is a structured program where we're calling people in to the surgery when they're well twice a year with chronic disease. And we do have a making every contact count part to that, where we will ask the patients, are they smoking? If, you know, we will give them advice, and then we will look to support them if they want to quit smoking as well. So that's an important movement now in general practice, that hopefully these guidelines now, which I have to congratulate everyone on who was involved in them, really provide that evidence-based support to what we're doing in general practice as well. So it's a very positive thing.
And can I ask you, Mark, your thoughts in terms of, is there anything that we can do within the health services, or anything that can be done more generally at a policy level to make sure that we maximize the great opportunities that there is in primary care to work with people and deliver good stop smoking care?
Yeah, I mean, to me, an obvious thing in general practice is the government could support us better in terms of providing stop smoking medications to our patients. So, for example, nicotine replacement therapy, it's not covered on the drug payment scheme. So for those patients who don't fall into the category of having a medical card, they're not eligible for reimbursement when they use nicotine replacement therapy. So that in itself provides a barrier to a huge portion of the population to stop smoking, because of the cost associated with it, where that doesn't apply for things like diabetes, for example. The government cover the cost of those medications, no matter whether the patient is a medical card holder or not. And the other thing then is for our patients who are medical cards, who do have medical cards, there's particularly stringent dispensing rules on nicotine replacement therapy. So whereby they're disincentivized. For example, someone can only get 2 weeks initial treatment, and then they have to go back to their family doctor or GP for a further prescription, rather than being able to have that dispensed by the pharmacy. So GP's time at the moment is particularly constrained, and there's a barrier for the patient. You know, at the moment we're having to, in general practice, really prioritize certain things for a quick appointment, and you lose that gap of being able to provide that ongoing care for the patient, because on any given day we may not prioritize that particular consultation. So that's another important thing that could be done as well.
Okay, very, very important messages there, Mark, and a very key focus within the guidelines on the important role that stop smoking medicines can play in helping somebody to quit. So I suppose what we want to do is make them as easy for people to access as possible. So some points there for us to work on within the HSE with our partners in the Department of Health and government in examining some of those barriers. And Martina, is there anything that the Tobacco-Free Ireland programme has been doing to try and support GPs like Mark to link people who want to stop smoking with stop smoking services?
Yeah, absolutely. We have been working over the last number of years on a national patient electronic management system called Quit Manager. So all of client interaction is recorded on the one national IT system where everyone has access to. And we're working, it's still a work in progress, and we're working to integrate our system with different other IT systems in the HSE. And we've seen the benefit of that over the last couple of years, particularly if there's been gaps in service in acute areas through COVID, that there wasn't a gap in client care where clients could be referred to another service. But for GPs, what we've done last year is we have enabled HealthLink referrals. So now there's an ability to electronically refer a refer from the a GP patient management system directly into services. And when that referral comes in, we'll process it and we'll send them back to a local stop smoking advisor in their area, and so they can be the client then can access both the behavioural support as well as the medication, and obviously there's higher success when they access both.
That's great. Thanks, Martina. So look, Gary, I'd like to bring you in for the final word here and close out our panel discussion. So, as I mentioned, sometimes when people who smoke use our health services, and so many of them do on a day-to-day basis, many of them because of harm to their health that's been caused by smoking. But unfortunately, some of them tell us that when they use our health services, nobody ever asks them about their smoking, or nobody ever signposts them or offers them help to stop smoking. Now, you did have the experience of somebody raising your smoking with you, and that led you then to linking with a stop smoking advisor and having success with your quit attempt. So really, just to give you the final word, is there anything that you would say to our healthcare professionals across the country in terms of the opportunities that they have to work with people who smoke through these national stop smoking guidelines?
Well, I think if they refer people directly back to your cessation program, okay, it will help a lot of people. Now, I agree with Dr. Mark O'Kelly in relation to the costings on the different nicotine replacement therapies. They are a psychological barrier to the smoker, even though he's spending more money on cigarettes. It's the fact that he's buying something that he doesn't want to buy. Now he goes, no, I'd rather buy the cigarettes, okay? So it's a psychological issue. But what I would say is, no matter how many times you've tried, and I have tried time and time again, continue to try, because eventually you will quit like I have. It has taken me 45 years to get there, but I'm there now, and that's all that matters.
That's great. Well, look, well done, Gary, in terms of your success with stopping smoking. And thanks to everybody for the contribution to that panel discussion. So we'll draw things to a close. And what I'm going to do now is introduce Dr. Colm Henry, who's the Chief Clinical Officer with the Health Service Executive, who has some concluding remarks. And then I'll hand over to Rachel Kenna to close out proceedings this afternoon. So on my behalf, thank you all for attending the launch of these national stop smoking guidelines today. And I'll hand you over now to Dr. Colm Henry, followed by Rachel Kenna to close out the session. Thank you.
Hello, Dave. I'm pleased to welcome and endorse the publication of Ireland's first national stop smoking clinical guidelines. We've delivered good progress on tackling the harm caused by smoking in Ireland, and it's easy to think our work is done. But the continuing impact of smoking on our health is staggering. This week alone, over 100 people will die from smoking. Over 1,000 people will be hospitalised, and many more will be using our primary and community care services for smoking-related illnesses. Smoking continues to be the single greatest preventable cause of ill health, disability and premature mortality in Ireland. There's a huge opportunity for health services and healthcare professionals to tackle smoking-related harm for people who smoke that use our services. This work has always been important, but the link between smoking and increased risk of severe COVID-19 disease progression underlines added urgency. The good news is that through these new national stop smoking guidelines, we now have a clear and comprehensive description of what good stop smoking care looks like. Good clinical care to help people stop smoking is as important as good care for the diseases which we all know it causes: heart disease, stroke, lung disease and cancer. In addition to describing good stop smoking care for the general public who use our primary care, community and hospital services, I'm especially pleased to see that the new guidelines have given focused consideration to users of our mental health services and women who are pregnant, because they have particular needs when it comes to stop smoking care. Through these guidelines, we can now all play a part in helping to tackle smoking-related harm in Ireland. Each working day, every healthcare professional meets and provides care to people who smoke. Making an attempt to stop smoking is the single best step anyone who smokes can take for their health. Unfortunately, many people take this step alone without seeking advice from a healthcare professional. I would urge anyone who is planning to quit or has recently quit to gain advice and support from a healthcare professional. For healthcare professionals, the guidelines recommend 3 simple and easy ways to remember steps that each of us as healthcare professionals can take in our day-to-day practice. Firstly, routinely ask people about their smoking. Secondly, advise them to stop. And thirdly, offer them evidence-based stop smoking care, including stop smoking medications and referral to a HSE stop smoking advisor. These 3 clinical steps can significantly increase the chance of someone becoming smoke-free. Because these guidelines have been through the rigorous processes of the National Clinical Effectiveness Committee, we can be confident that the care recommended is safe, effective and clinically sound. Now is the opportunity for healthcare professionals and managers of our health and social care services to work together to examine how they can best develop stop smoking care across our primary, community and hospital services in response to these guidelines. A range of resources are already available and are in development to help, for example, through our new work on enhanced community care and Sláinte Care health community programme areas. Please find out more about these new national stop smoking guidelines and go to quit.ie to review all the resources and supports that are currently available to help people to quit smoking. I wish all involved the best with the launch and the implementation of these guidelines today, and congratulations on this piece of work. Míle buíochas, slán live.
Thanks very much there to Colm. I think he has summarised some of the key messages from this afternoon's launch really well, emphasising, of course, the good care that comes through the use of guidelines such as this one. I really want to express my thanks to all the presenters and panellists today for their really interesting input. It has been a great afternoon. In summary, I would like to agree with Paul's earlier comments and welcome the endorsement from Minister Fian. We heard him say that this guideline is an important advance in our collective national response for tobacco control. And also then from Mr. Paul Reid, as CEO of the HSE, he set out very clearly the impact of smoking-related harm on the health services, and his support is key. Today's launch, and indeed this guideline, can only be said as timely. Paul and Mark both reminded us that COVID has impacted so much, including this important work around stopping smoking. I would also particularly like to acknowledge the Trojan work, which we've heard throughout this afternoon, that has been undertaken in relation to support people who wish to stop smoking. We heard in particular from 2 key areas of mental health and maternity services, where this work is so important. We also heard some key insights from an implementation context, which is also critical to the success of the work that has gone on before this. Gary's comments are particularly resonating with me, the importance of this individual and supportive approach and the fact that it works. From an implementation perspective then, the guidelines are reaffirming the importance of stop smoking and the work that goes on with this. And this is key to support implementation of the guideline. We heard that some of the implementation challenges, which are a particular important focus. We heard a lot about its alignment with other work, key priorities, key policies and strategies, and of course, Sláinte Care. As we know, this time of year is traditionally a time when people set new health and well-being goals for themselves. And for people who smoke, the most important thing that they can do to improve their health is to quit smoking. In relation to the stop smoking guideline itself, as we've heard today, it really is just the end of the beginning of the journey. We've heard the importance of implementation, which is an integral part of the NCEC guideline process. This guideline, like other NCEC guidelines, contains a comprehensive implementation plan and a budget impact analysis to support successful implementation of the recommendations in this guideline. The development of this guideline is another tangible example of the multifaceted approach that is taken to reduce the number of smokers in our country. It recognises that quitting smoking can be difficult and complex, and not just for the smoker, but also for the healthcare professionals trying to assist people in making a healthier choice. Together with other elements of Tobacco Free Ireland programme, this guideline will ensure that those who wish to quit have access to high quality support and give them the best chance for success. With that, I would really like to thank you all for your time today and congratulate all involved in this really significant achievement in developing the clinical guideline of international standard. Of course, this does not happen without a great deal of hard work, and I would really like to acknowledge the members of the Guideline Development Group and the staff of the HSE Tobacco Free Ireland programme. In particular, I would like to thank Dr. Paul Kavanagh a consultant in public health medicine with the HSE National Intelligence Unit and chair of the Clinical Guideline Development Group. And your presentation gave us a great insight into the amount of work that it took to get us to here today. This guideline, Paul, is a testament to your leadership and to your team in advancing evidence-based care to help people who wish to stop smoking, and is another step closer to achieving tobacco-free Ireland. I would also like to acknowledge the input from Aisling Sheridan, Evidence and Information Manager, and Martina Blake, National Lead for HSE Tobacco Free Ireland programme. This guideline is based on the robust evidence base, and I would like to recognise the evidence synthesis input, of course, from a number of research groups, including the HRB, the HSE, and the Health Information and Quality Authority. Finally, just to say, the guideline has been published on the department's website this afternoon as the latest in the suite of NCEC national guidelines. I would also refer you to the Tobacco Free Ireland programme HSE webpage for further information on the Quit campaign and other stop smoking initiatives. Thank you all for joining us this afternoon and really acknowledging the work that went into both this afternoon, but also the clinical guideline.